Dr. James Davis.
Thank you, Mr. Deputy Speaker, and it's a pleasure to rise in support of the Queen's speech today. Now, the past year has highlighted the challenges facing our health and social care systems, and I welcome this government's legislative agenda, which will tackle some of the most pressing issues. In the short time available today, I'll focus my comments on three issues: plans to tackle obesity, the potential benefits that UK-wide comparable healthcare data could bring, and the need for better access to and choice of secondary and tertiary healthcare for the residents of North Wales. In the UK, 63% of adults are overweight or living with obesity. This places an enormous strain on the NHS, reduces quality of life and stifles economic productivity. The government has a clear agenda to tackle obesity, and I welcome, among other measures, the confirmation of a total online ban and 9 p.m. TV watershed for the advertising of high-fat, salt and sugar products. The commitment to legislate for calorie labelling in cafes, restaurants and takeaways is also welcome, and whilst I acknowledge certain concerns on behalf of those with eating disorders, I believe that this policy will have a clear net benefit for our national health. I would ask whether progress can also be made on the introduction of calorie labelling for alcohol products. I'm in no way anti-alcohol, Mr. Deputy Speaker, as you know, and in fact I'm a proud member of the Beer and Wine and Spirits APPGs. But I believe that there is currently poor awareness that alcohol consumption is a significant contributor towards our national obesity crisis. An alcohol calorie labelling programme would be a useful tool to enhance the plans already outlined in the Queen's speech. The availability of comparable data on COVID infection rates and vaccination rollout throughout the country has been a key driver in our response to the pandemic. Yet looking at healthcare more broadly, comparisons between England, Scotland, Wales and Northern Ireland can be difficult. Personal experience as a GP, anecdotal evidence and basic comparisons indicate that despite the hard work and commitment of health staff, patients in Wales often receive inferior levels of service when compared to their friends in England. By introducing UK-wide health data, politicians at all levels will be held to account, practitioners and policymakers can better share best practice, and ultimately equal health outcomes will be promoted. Such an approach would be complemented by the establishment of independent UK-wide healthcare inspection, safety and audit mechanisms. In short, Mr. Deputy Speaker, we have opportunities which I believe we must seize to level up healthcare. I would ask my right honourable friend to consider what the UK Government can do to protect and promote the health of all British citizens beyond the legislative programme that's already been announced. I'm looking forward to seeing the progress of the Health and Care Bill. I do hope that as part of the legislative process, the Government will consider the challenges that Welsh patients currently experience, whereby access to specialist healthcare treatment in England is typically dependent on restrictive contracts or individual funding requests